today I do appreciate, Madam President, the opportunity to talk a little bit about why it's important to get vaccinated. We're trying to remind people that even though the disease outbreak has receded in the last month or so, we really have a window of opportunity to save lives. We have about 150 million vaccine doses that are now available. States are still ordering vaccine. Most states, including New York, have opened up the vaccination process to everyone, not just the high priority populations, but everyone. Because frankly, getting vaccinated is the best way to stop the spread of this disease. We had a big wave in the late spring and early summer, another big wave in the early fall. What we'd like to do is avoid a third big wave. And unfortunately, we have fairly recent history in the late 50s. Now, most of you don't think that's fairly recent, but believe me, it did exist. And we had a pandemic, we had a vaccine, and had a very similar pattern of spring outbreak, summer outbreak, and then frankly, the public health officials thought it was over and did not encourage vaccination. And what happened when the flu season hit in earnest in February and March, many more deaths and many more hospitalizations. So we can't tell you that's exactly what's going to happen, but it is a good possibility. This disease is pretty deadly for a number of people. And what we know is it's a young person's flu, that this really targets a younger population, which is why I'm glad to be here at a college to talk about that. And about a third of the cases in both children and folks under 50 who have gotten seriously ill, been hospitalized, or died are folks with no underlying health conditions. So it is impossible for us at this point to tell you if you're going to be one of those people who could get seriously ill, but we know it's happening. 2 folks from New Jersey just died in the last week, so people are still dying from H1N1, and it's just a great opportunity to get the word out. I was pleased to see that the college has these lovely cup holders that say the flu ends with you, get vaccinated, and it's an attempt to help to push the public service message. This really is about some personal responsibility, because even if you're not going to get terribly ill from the flu, you don't know if your classmate or colleague, if your younger sister or brother, if your aunt or uncle, if someone down the street is somebody who is much more likely to be susceptible to a serious case. So it's an opportunity really to take advantage of lots of vaccine and availability. We also have one more thing that I'd bring to your attention, and then I'm eager to hear from the students and talk about what you want to talk about. We just have a recent application for Facebook. If any of you have a Facebook page, you can become a flu fighter. You can choose your very own avatar to put on your Facebook page. It gives you a way to make comments on how bad the shot was, whether or not you had any difficulty, and share it with your friends. Challenge them to become flu fighters. So we've been trying to reach out to a younger population through some non-traditional media, using Facebook and Twitter. We had ads on some of the bowl games. We've had our own PSA contest on YouTube with a hip-hop doc who won the contest. So trying to make it clear that this is serious, and we really hope people will take advantage. We know we have a safe, effective vaccine. Over 61 million people have been vaccinated. There are no side effects that have been determined. 100 million people every year get a seasonal flu shot. This is made exactly the same way, so we have years of good safety records. So there's a lot of great information at flu.gov, which is the website, flu.gov. You can, if you don't take advantage of the proximate vaccination clinic, you can type in your zip code and find out where in your neighborhood vaccine is available and what hours it's available. There are lots of Q&As about, is it safe, is it effective, some history, a lot of information for pregnant women and younger folks and some of the priority populations. But again, I really appreciate the chance to be here at Hunter to share the information with you and to really urge you all to help us be part of the team to save lives, because that's what really this is about. Vaccination is one of the great public health triumphs of the 20th and 21st century, and we just need to take advantage of the fact that we were able to identify the virus, get a safe vaccine in place in 6 months, which is record time, and now we just need folks to take advantage of it.
I wanted to say a few things about the epidemic and raise questions both for you and for our students who are often in the front lines themselves. First, I think it's especially important that we look, as we respond to H1N1, that we do it in ways that reduce rather than perpetuate the inequities in health that have characterized our society for so long. So often when we have innovation, we have wonderful new programs, they go to the most advantage instead of to the least advantage. And I'm hoping we can all think about making sure that both our immunization campaigns and our education campaigns reach all sectors. Second, I think, fortunately, we've been lucky in these first 2 rounds of H1N1. They've not been as catchy as we feared maybe earlier on. But I think it's particularly important, we might not be that lucky in the years to come. And it's particularly important that we learn from these experiences. And I'm sure that HHS, but I think also those of us here in the university, have to see how are we responding? How can we do it better next time? How can we make sure that we reach all the people affected? And I think it's particularly important that we study the behavioral consequences of our response to the epidemic, not just the epidemic. We've seen oftentimes our response has created new problems in infectious disease epidemics, so we want to make sure that doesn't happen. And the last thing I want to say is, if 75 years ago, 35 years ago, 15 years ago, Congress had passed health care reform, we would be much better able to respond to this epidemic. And I hope we don't lose that chance again.
Hear.
And I'm urging all of us to make sure in the next few weeks that Congress votes on, passes this imperfect but big step forward legislation so that we have a system in place to deal with this more effectively.
I think you'll be pleased to hear, Madam President and members of the faculty and students, that one of the, I think, probably unintended, but I think very important consequences of this effort to deal with H1N1 has been a very robust and collaborative relationship with state and local health departments who, in many parts of the country, and I know here in New York, are often understaffed and underserved, and these tough budget times have made it even tougher for people to respond. But in spite of that, we've had people really step up, figuring out very creative ways to get vaccine into underserved community. Once the vaccination protocol was determined by the scientists who were the most likely vulnerable populations, then a huge effort was underway to figure out how to reach those folks, both in terms of a message and in terms of outreach. We went from a typical vaccination distribution supply of about 40,000 areas where kids' vaccine is usually distributed to 150,000 sites, determined really by local health partners who said, if we're going to reach pregnant women, here's where to go. If it's, you know, the younger kids, how we get to non-English speaking populations, what about the tribal communities? And not to say that that effort won't need lots of improvement, but I think it's a more robust relationship, according to my colleagues, than has been in place in years and years. And my goal is not to lose that relationship, that once H1N1 maybe passes, to figure out other ways that we can really use that federal to state to local outreach with private providers and public health workers to then tackle the next challenge. There'll be lots of lessons learned, and we're doing an entire review, not only about H1N1, but really about the whole responsiveness to a pandemic. We were lucky in many ways. Not only has this virus been more mild than could have been, and we still don't know when it's going to end, and it is still serious, but we kind of knew it was coming, and we've dealt with flu viruses before. But we were able to identify some very serious gaps even in responding to flu. We're still using technology that's 50 years old. to grow the vaccine. It's imperfect, it's slow, it's unreliable in terms of, as Dr. Tom Frieden, who we stole from New York, turnabout is fair play, likes to say, even if you scream at an egg, it won't grow any faster, which is very true. But so we have lots of gaps in the system. We don't have nearly the manufacturing capacity here in the United States. We're very reliant on other countries to actually produce vaccine, not only for this, but for a variety of other countermeasures. So we have a lot of issues to tackle, and I really look forward to circling back and coming back to you all and taking you up on your offer that we'll work together. But I think the final point that you made, the underlying, you can't talk about health disparities without talking about the fact that we are a nation, and really the only developed country on earth where we think it's okay, at least some people do, that we have close to 40 million people with no real ongoing access to health care. We have too many folks without a health home. Some of the efforts that you're making on preventable disease won't be solved until we actually have a reformed health system, and until we can focus on prevention and wellness and have an opportunity for everybody to access health care at the front end and be involved in preventive care. We are clearly working on workforce issues. And again, your diverse workforce population is absolutely on target, because in so many communities, the barriers are not just the lack of personnel or the lack of insurance, but it's cultural barriers to get appropriate treatment and have an opportunity to communicate with patients. So there are a host of challenges, and it sounds like you are really on the forefront of identifying a lot of them.
Ted Ryu, I'm a graduate student in psychology, and Madam Secretary, I'm glad to have you here today. And it just happens that I work for a nonprofit company, which coordinates giving out mass influenza and the H1N1 vaccinations to the community. With the help of the New York City Department of Health and Mental Hygiene, CDC, and also the support of Visiting Nurse Services of New York. And we managed to give out 1,700 regular seasonal flu vaccines and about 900 H1N1 vaccines this year. And I'm saying this from my personal experience. And my question is, I wish the distribution system for the vaccine could have been more streamlined this year. Because what happened was, I know the vaccines were in short supply, but doctors were not ordering vaccines. They didn't want to bother with it a lot of times. Because what happened was the reporting procedure was too complicated for them, and a lot of times it was too complex, so they just didn't want to bother with it. So a lot of times the doctors could not give out vaccines to the patients who were at risk. And doctors were given first priority and not the community-based nonprofit organizations like us. So I hope the next time around we can get access to vaccines more easily.
Well, I think that's a great point. I would tell you that those decisions were actually made here in New York City, not by HHS and not even by the state, that we really relied on local health departments to determine, in a time where we knew there would be more demand than supply, and we knew that who the priority populations were. We felt those decisions were best made on the ground, who actually should have the supply, where the site should be, who should be worked with. So that's great feedback. But some of the difficulty in accessing, I think, the vaccine or getting it into the right hands, should also be a conversation here locally, because the decisions about which sites, which providers were really done at the local level. And again, I think appropriately, the last thing we needed to do inside the Beltway in Washington is kind of pick and choose how to get vaccine to the target populations, whether it's in New York or California or Florida or any place else.
As you well know, immigrant workers and their families are much less likely to have health insurance. They're much more likely to be low income and have lower access to health care in general, particularly those who are out of status. And I'm just wondering, what have been the strategies for and the challenges in ensuring that immigrants of all statuses have access to the vaccine?
It's a great question. First of all, the federal government, and under the president's direction, decided early on that the effort to deal with this vaccine program should not have financial barriers. So the federal government has actually provided the resources to distribute the vaccine free of charge. There are some administrative costs now charged by private providers, but vaccination clinics at schools, for instance, were all free of charge. A lot of public health clinics were free of charge. So they took down financial barriers and did not ask for any verification of insurance documents. I mean, that was also seen as a huge barrier to potential vaccination. We have had lots of programs. First of all, everything on our website and all the materials are translated into Spanish. We have even Chinese variations. We have a variety of languages available. We've done a lot of programs, particularly with the Spanish-speaking community, everything from community-based organizations to Hispanic TV and radio, using media stars, using outreach programs. We also decided early on that it was really important to work with faith-based and community groups because clearly, given the uncertainty of immigration status, there are a lot of folks who are just reluctant to show up and sign any kind of form or give identification, feeling that that could lead to unintended consequences. So we've been working with a lot of church-based groups and community clinics, places where they're kind of trusted friends and allies as an outreach effort. But again, I think that's going to be something that we will be continuing to work on, to look at, and to try and see you know, what kinds of additional steps can be taken. But it was a challenge that was seen from the outset, and one that we've been trying to kind of break through in using any creative idea that anybody had to try and not only take down the clear barriers of filling out forms and having the financial wherewithal or having to show insurance cards or and the school-based clinics, in part, I think, also help to, at least for the children's population, and encouraging parents of children to also show up with their kids, help to make it clear that this was an outreach program that was available to everybody.
Secretary Sebelius, I'm going to venture a guess that you have experienced frustration, as I think most of us have, at the partisan nature of the healthcare reform debate. And I'm hopeful, and I welcome your crystal ball prediction of where that's going to go. But for many public health practitioners and academicians, our frustration certainly also extends to the challenges of extending the healthcare reform debate beyond insurance coverage, which is critically important and is recognized as a #1 priority, but going beyond that, really recognizing the elements that will make our healthcare system much more efficient and much more effective in reducing the morbidity and mortality of American citizens, creating more emphasis on health promotion, disease prevention, early intervention, and so on. And I'm very much looking forward and hopeful that at some point in the not too distant future, we're going to be able to begin to have those discussions and in a very meaningful way create some infrastructure changes that will allow this country to really be at the level of healthcare delivery that it should be.
Well, I think I share your disappointment in the increasingly partisan nature of the debate. And I don't see that changing in the next round of the final passage of this bill, unfortunately. But I think that the discussion is likely to change dramatically once the bill becomes law, and then the implementation starts. And the good news is that the legislation, about 80% of the legislation, focuses on what you've just identified. There is a portion that is about insurance reform, not only changing the rules for the companies who provide insurance now to Americans, but providing access and affordable coverage to those who don't have access. But the vast majority of the legislation really deals with everything from re-emphasizing prevention and wellness and strategies to begin to move in that direction. Enormous opportunities for our payment system through Medicare particularly, but also Medicaid, to be the financial levers to change the delivery system. Right now, our payment system, I would suggest, is full of sort of perverse incentives to provide more treatment, but not necessarily the best treatment or the best quality. And, you know, doctors are paid if their patients are sick, but not very well compensated if you keep your patient well in the first place. So there is a lot of opportunity to really make a shift. Prior to the health reform debate, there was a huge investment in the Recovery Act for health information technology, which I think is a huge piece of this puzzle to finally move into a not only electronic medical records for the consumer side, but really begin to change the way medicine is practiced. So providing an opportunity and really an emphasis on collaborative work and making sure that an entire patient's history is able to be viewed, and there are strategies. You can integrate, I think, medical delivery systems virtually. You don't all have to be in the same building and work for the same provider. There's a big emphasis on enhanced workforce and community health clinics, which I think are a big piece of the backbone of the public health infrastructure and will remain that throughout this country. So there's a lot of opportunity in this legislation unfolding over the next decade that I think will lead to a transformed health system, and that really is what I'm excited about. I kept saying to friends and colleagues who said, I really want to work on health reform, you know, and I want to be lobbying in Congress or doing something. I said, no, health reform really starts the day the bill is signed. And then it's really about what opportunities there are to transform the health system in this country. And I think we will have the framework to do that. And a lot of the work, I'm glad to know you're heading to HHS, because a lot of that responsibility and opportunity will fall within the Department of Health and Human Services as a leader, but then working in a very collaborative fashion. So I hope you all get ready. Because the work has just begun. I like to say to folks, the number of paragraphs in the legislation that start with the secretary shall ... are quite extraordinary, and we're the ...
My question is, when you say the disease is pandemic, how pandemic it is? I mean, countries in the Western world, or just, I want to know the statistics, which other countries have the H1N1 virus. And for the students, how do you intend to reach out to college students? Because there are 22,000 students in Hunter College, and if you're having 1,000 vouchers, other students have to pay $15. And I know students don't like to pay, and how do you want to make it free or something that, we show our ID, we get it free? Because the main motivation for me is going to be, I'm going to get this H1N1 virus because it's free and I have nothing to lose than paying $15 and I'm going to get sick. So
I just want to say we're negotiating with our financial officer on that. And I've told him when the first 1,000 are gone, I'm coming back to him. So unless the secretary is going to agree to pay for them here.
I don't think I can make that promise. First, the question about pandemic is a great question, and pandemic is really a term about geography, not necessarily severity. So when Dr. Margaret Chan at the World Health Organization raised this to the level of a pandemic, it was really identifying that at that point it was in 109 countries, and it was throughout multiple hemispheres. So H1N1 really is now a worldwide disease. It was started in the northern hemisphere, but it has spread throughout the world. And that's really what raised this to the level of a pandemic, is the widespread identification of H1N1 in various parts of the world. I share your concerns about financial barriers, whether it's students or others, and I think, again, that's why the federal government, the vaccine itself has been provided free. So I think there still are likely to be health clinics here in New York City who are providing it free. Some doctors' offices may be charging, some private providers, and I think this is a drugstore provider who may be charging an administration fee, but the likelihood that you could find a free vaccine is still pretty high because it's being pushed out. It was bought by the government and shared with states and local units on a free basis. So that's why I suggested if you're not in line, but the first 1,000 are free, so go get yours right now.
Go today, right?
You can be at the front of the line. There are not 1,000 people in this room, so you can beat the clock. But if it starts being charged, then I think searching out through the vaccine locator, through a zip code locator where it might be available free of charge is also an option. And again, thank you so much, not only for having me here today, Madam President, but thank you all for the work that you are doing, for the studies you're engaged in, and for the work that you're going to do to keep not only people in America, but people across the world safe and healthy in the future. And I look forward to working with you on a more prosperous and healthier nation and nations around the world to come.
That's such a wonderful message. The Hunter motto is mihi cura futuri, the care of the future is mine. And clearly you demonstrate that motto just inspirationally. So thank you so much for being here.
Thank you.